can barely see it. We're good. Don't do it down because then you can see it. Hello, TikTok, and hello, YouTube. Good to be back. I missed last week because why did I think I had a lecture last week. Oh, yes, I had a lecture. Last week, I was speaking about hormones and weight to the Integrative Psychiatry Association, which is doing Precision Medicine Fellowship. So this week, it's been such a crazy month for teaching. I just today recorded a webinar for the ZRT lab. They're one of the labs that has saliva testing, urine testing, blood spot testing. And I talked about all types of testing. And that webinar was a free webinar for any of you. If you guys are practitioners, it should also be up on their website, ZRT Labs. So that was super exciting to be able to talk about one of the things I'm most passionate about. I also just took my recertification for my integrative medicine boards last week. So it's been a crazy week. I don't find out till 2 months if I pass. So hopefully there are no issues there. But for those of you that are just joining, speaking of testing, we have a new free download, is your guide to hormone testing. So go to any of my posts on, I'm going to get to your questions in a second. So thank you for starting to have them. But go to any of my posts on Instagram here, Hormone Guru MD, or here and comment testing. Is it on TikTok also, I think? You should be taken to our free download. I know it works on Instagram. So if you're not following me, Hormone Guru on Instagram, MD on Instagram, follow me here. Click the link in my bio here to sign up for our free newsletter that comes out on Tuesdays. And does it work on TikTok, the comment testing comment?
Not sure, on Instagram.
On Instagram for sure. So if you're interested in getting that free resource, make sure you do that. And if you are not subscribed to me on YouTube, please subscribe so we can get those views up. So Kimbra 1010 says, I gained too much on bioidentical HRT. So, it's interesting because I actually had done that lecture last week about hormones and weight. So too much estrogen can make you gain weight, but too little estrogen can make you gain weight. And it's a known thing that when you go through menopause, the amount of calories that you burn actually decreases. So there must have been something with the dose, I'm guessing. When you have low estrogen, you actually are insulin resistant. So maybe it was too high of a dose. Hard to know, Kimbra. It could have been a lot of things. And again, you spent $500. See, that's the thing. One click. I don't know what hormone costs $500 except for Ozempic or semaglutide. I mean, most of my patients pay $10, $20 for their estradiol patch. They may have to pay $50 for compounded testosterone. They might have to pay that for a compounded progesterone, or they're paying a $10 or $20 or $30 copay. I don't know what should have been $500 unless you got a pellet. That was not the right dose. So I can understand how that would be frustrating. And that's part of the problem with the bad rap for those of us that are doing hormones, is that everyone thinks that it costs too much. And so, yes, a lot of times the office visit is not contracted with insurance, but the actual hormones themselves should not be $500. That was the total of all the compounds and the appointment and the blood test. Okay. Blood testing, when we order it, if you have insurance, unless you have a high deductible policy, it is often covered on insurance. So again, I'm sorry that was your experience. I don't know who you went to or what the situation was, but I do know how things run in our practice, and most of our patients do have coverage for their lab test. Now, I personally have a high deductible, which means my insurance doesn't cover anything until I have personally paid $3,500 for myself. That's copays, that's medications, that's blood work. But we do have a discounted rate for blood work for our patients like me that have that. So if that was your case, then that was just that could have been the consequence of your insurance. But I'm happy to be here today. As I mentioned, we've got a free hormone course that we've just revised. You can click the link in my bio here. It's short videos, short digestible content for you to learn about the things that we hear the most about. You can also, and as I mentioned, that is free. You can also check out our free non-hormone or natural therapies for mood issues, so antidepressants. Speaking of which, I know there's not a lot of people who are on yet, but I'm thinking about doing a live with an integrative psychiatrist. She is just getting ready to launch her book, Think Outside the Bottle, and she talks all about integrative therapy for mental health, uh, anxiety, depression. So keep following me, sign up for our newsletter to find out when that's going to be. And so Purple Heart, good to see you back here. Three Purple Hearts. Is 1 milligram testosterone enough to help us with bone health or osteoporosis? Great question. Remember, again, excuse me, a lot depends on your level. We know that a third of the milligram a day is what women make in their reproductive lives when they're having hormones, but testosterone also decreases with age and with stress. So it depends on, that sounds like a good dose, and it depends on how are you taking the 1 milligram? Are you taking that sub Q, like with a topical dose, or is that an injection? So it really depends on a lot of things. It's hard to really say just based on that. Heather, you're in perimenopause and have mast cell, Lyme, and more. Any suggestions? So I'm not a mast cell expert, but I do know my patients that have both. It's usually a methylation issue because histamine has to be methylated, or they usually do better with some kind of natural antihistamine like cromolyn. I put patients on that, or quercetin. So obviously, getting your estrogen in check is going to be really important for you because histamine, like I said, estrogen can cause histamine to be worse if it's too high. Purple Heart 7, if that is a total testosterone, that's pretty low. So 1 milligram topical is a decent dose. So Heather says, yes, I have MTHFR. So that's usually related to it. And you're on quercetin. Well, your OB-GYN is not trained in mast cell activation, but maybe you mean your OB-GYN won't do anything about perimenopause. So same thing. And I can tell you that as an OB-GYN, we don't have any training in perimenopause, menopause hormone issues, unfortunately. And we can deliver a baby, we can do a hysterectomy, we can prescribe contraception, but we're not trained in that. So that's probably why. So I would consider Heather getting another person to manage your hormones. John, thoughts on HGS for a patient with a TBI? Oh, wow. That's a great question. Um, I don't know that a lot has been looked at, and it depends on what kind of TBI they had. I do know there's a lot with progesterone in TBIs, a lot with gut health in TBIs. I am guessing there's probably something there, some connection. We would measure an IGF-1. I think also something like Simorlin would be also good for that. But I think the problem, John, is there's probably not a lot documented about that. So Purple says, I see women taking 5 milligrams topical testosterone. Is that too high of a dose? The problem with higher dose testosterone is they can turn into estrogen, and without knowing it's one enzyme, it can aromatize. So 5 milligrams is a higher dose. Remember that topical is very, very well absorbed. So if you're giving yourself 5 milligrams, and I've told you that your body produces a third of a milligram, that's very high dose. And so if it's not going to testosterone, where is it going to? It's going to go to estrogen, and it can make you gain weight. But it is on the higher side for a topical dose. Heather says my Lyme doctor helps you with mast cell. Okay. Oh yeah, I know. So one of the things you can do, Heather, is look in maybe A4M, their directory, and just have somebody, because your Lyme and mast cell doctor is probably a little bit integrative. And if you look in the directory, you can find a provider, put in your zip code, and maybe select out A4M, right? A the letter 4, all right. The letter A, the number 4, M. I think it's either .com or .org. They do have a directory. Okay. TikToker, can estrogen make periods lighter? This is happening to me, and my doctor is puzzled. So when you mean estrogen, what do you mean? Are you taking estrogen? Are you taking a synthetic estrogen like a birth control pill? I'm not sure what you mean. Mary Daniels, good to see you. In Perry on HRT, much better, still low moods. Is that to be expected? Yes, it's high because estrogen, when it goes down, serotonin can go down, and estrogen when it goes up, and there's all of your hormones are connected to a neurotransmitter in some fashion. So I think that that could be part of it, and the drop in progesterone also. So, like the mood fluctuations are real, right? And because you could have high estrogen 1 month and low estrogen the next month in perimenopause. Yes, good luck, Heather. I hope you can find a provider. Um, okay, TikToker, a pellet. Okay, so I'm wondering why you got an estrogen pellet if you're having normal periods. So I guess that's the issue. Wondering what, I mean, high dose estrogen will suppress you. That's what we give to women who are gushing in the ER. We give them high dose IV estrogen. So, yes, it's going to shut down your normal cycle. So hard to say what you're doing. Have you heard of Amare Happy Hormone Pack? My MD doesn't recommend HRT for me. No, I have not, MJ. I've not heard of that. TikToker says no, they were heavy periods. Yeah, so heavy periods usually means you have plenty of estrogen. So I don't know why you would get an estrogen pellet. I mean, a lot of times progesterone, you take progesterone, or you might even take some testosterone, like we hear. What do you think of Testim for women? Kim Gallows. So Testim is probably a supplement that off the top of my head, I don't know exactly what's in it, unless you're talking about testosterone. But Testim is some brand that I don't know what's in every brand. Why can't I tolerate systemic bioidentical estrogen? Yvette, whenever I hear a patient can't tolerate it, it's either the dose or you have a problem with your estrogen detoxification. So you hang on to estrogen, and that's when we usually would look at a urine test, either from the dried urine, from ZRT or Dutch or Vibrance new urine test, the hormone sumer, to look to see how you get rid of estrogen. And apple pie itchiness, yes, that is a symptom of perimenopause and menopause. Topical estrogen to regain clitoral sensitivities after SSRIs. That would probably not be my first choice for that. I would want to try for clitoral sensitivity. I would, the misbehaving Disney adult. That's what my daughter is, a Disney adult. I would actually recommend DHEA topically for clitoral sensitivity. It's much, much better for that. And there's not as many estrogen receptors on the clitoris as there are androgen receptors. So Kim says testosterone. Okay. So, Testim. Okay. So Kim, you're talking about Testim is a brand of testosterone. Okay. Thank you. Yes. I think women need testosterone, and I like to measure it and prescribe it based on what they are. I believe that Testim itself is concentrated in a male dose. So what that means is, let's just say I said that women produce 1/3 of a milligram a day. Men testes produce 5 to 8 milligrams a day. So if you have Testim, it's dosed for each volume. So let's just say 0.5 mLs, which is about enough cream as my thumbnail, is 5 milligrams. So you'd have to give yourself a lot less to equal a half a milligram or 1 milligram, unless you're giving yourself 5 milligrams, which again, then you have to worry, is it going to run into estrogen? Is it going to, make you have too much estrogen, too much testosterone, that kind of thing. Okay, and apply anything for itchiness. So, are you itching kind of all over your skin? Are you having a rash? Are you having general itchiness? Quercetin would be something that would be a natural antihistamine that you could try for that. The misbehaving Disney adult. I have estrogen patch. Can that restart periods? I have had none for years. Early menopause, 44 now. Wow. So that is considered premature menopause. And the guidelines are that you absolutely should take estrogen until the age of natural menopause, which is 52. So I'm hoping along with that estrogen patch, you also have some progesterone. Um, but yes, you would definitely need it. Okay, so what was your question, misbehaving adult? I think you were looking for decreased sensitivity, maybe. What was your initial question? I lost it here. Nope, that wasn't your question. All right. And also, somebody alerted me that sometimes some words are triggering filters. So if it doesn't seem like I've answered your question, or I've skipped your question, just change some of the words. So Chloe, hi, can I take 100 milligrams of progesterone bioidentical kind in pill form to help with endometriosis? So in many of my endometriosis patients, that has helped. I also with endometriosis found that it was helpful. So yes. Mary Daniels, once period is over and hormones stabilize, will mood and anxiety level out? Thank you. Great question. What I see a lot of times is when estrogen plummets and it's low, sometimes people have depression at menopause, and also at perimenopause, they have new onset anxiety. So, yes, when they level out and you'll get replaced to the level you are, yes, those ups and downs should improve. C. Barton, let's see. I just lost your question. Here we go. Can I have a blood panel Dutch before the first visit with you so we talk about plans? Actually, we can't order any labs for a patient that's not ours. So we aren't able to order anything until you're established with us. And so if you have another one from another provider, we can take a look at it and potentially use it, but we can't order for anybody that's not our patient. Brandon Conley, vitamin D levels. So in the units of, let's say LabCorp, their numbers are 30 to 100. We like it to be at least 50 to 70, if not 50 to 80. There's some data that too high of a vitamin D level can be associated with pancreatic cancer. Too low of a vitamin D level, obviously associated with lots of other cancers, including rickets.
He also wanted to know about wild yam cream, if it works or it's a hoax.
Oh, there's a question on YouTube. Okay. Okay.
Guy.
Okay. So the wild yam cream does not contain any progesterone in it. The wild yam is a precursor for progesterone that is manipulated in the lab to make bioidentical progesterone, but the wild yam cream itself does not contain any progesterone. That topical cream could help people's symptoms, but it's not going to have the same action as progesterone. It's not going to downregulate the estrogen receptor. It's not going to cause cell death of the uterine lining to protect the uterus. It's not going to do the same in the breast. It's not going to help bone. It's not going to bind with the GABA receptor in your brain to help actually help your moods. But the symptoms could be better with the wild yam cream. I don't think it's going to hurt you, but it's not actually progesterone. It's like if someone takes fish oil, could it help their moods? Yeah, it could, but it's not going to agonize the serotonin receptor if you have low serotonin. Angelica, have you seen estradiol cream increasing blood pressure? Okay, good question. Too much estrogen in any fashion can raise your blood pressure. That's why sometimes people on birth control pills, their blood pressure goes up. Summer Breeze wants to know about joint pain. Creatine. Okay, well, so joint pain is usually common with low estradiol. As far as creatine, I do know that it helps muscle and energy, but what we usually think about for joint pain are things like glucosamine chondroitin, turmeric, natural anti-inflammatories like that, and maybe even fish oil. Is there an OTC topical option, PBJ? Yes. Julva, Julva. My friend, Dr. Annika Becca, has made a topical over the counter. It's about $50 or $70 for a bottle that can last you a long time. She just actually launched a new hair care product that I'm using on my hair for menopausal hair. And I just got an email today that she is actually reformulated a lubricant. That's not medical. It's not medical, but the DHEA in that, there's also rose hips. There's also, I think, maybe coconut oil. I'm not sure, but there's a few other things there. Kim, your levels are at 0. Okay. All right. Well, if someone's giving you test Tim, I think I would give it a try and potentially you could feel better. As I don't think there's anything wrong with it. It has to be monitored correctly and dosed correctly. Okay, user 88888888855555554 had hysterectomy. My OB-GYN won't give me HRT higher than 3.5 and no testosterone. What's 3.5? Oh, maybe 3.75. So I don't understand that. I don't understand when a doctor doesn't. I mean, I guess if they don't want to give it to you because they don't have experience with it, then user 8888, you can actually ask for a referral for somebody else. Your OB-GYN can do your hysterectomy, can do your pap smear, can do your pelvic exam. They don't have to be in charge of your hormones. You can elect to go see someone who has extra training. I'm an OB-GYN. I did the extra training, and now I don't do the hysterectomies because I leave it to the people who do the hysterectomies and I do the hormones. So you don't have to go to the same person. Um, what testosterone range do you like to see in perimenopause? Again, it depends on the situation. There's not one range for this, one range for this, one range for this. We look at all the hormones, we look at the patient's symptoms. We like everyone to be in the middle to 50th to 75th percentile. It depends on your symptoms, it depends on your age, it depends on a lot of other things. So, Brandon, I would say wild yam cream, that's my opinion. I mean, again, it's not going to hurt you, but I would rather do progesterone. Okay. Misbehaving adult, you have progesterone. Okay. 189. I started taking Ollie Loving Libido. Is it worth it? I actually don't know what that is, but I do know I like the Ollie Sleep gummies, and I have bought the stress gummies for my daughter. They seem like they have natural therapies in it, but I don't know what's in the Love and Libido. ML Lizald. I'm getting heart palpitations due related to my hormones. What can I take? You could take some L-theanine, 200 milligrams. You could also take something called GABA or pharma-GABA. Those could be things that could be helpful. And actually, magnesium is something very safe. T. Loftus is 418 total and 53 free, testosterone low for a 39-year-old male. You know what? I don't have that data right in front of me on my computer at work. I have the age-related norms. I know for all ages, 300, 350 is a cutoff. I think for 39, that sounds like it could be a little low. For some reason, 450 seems like it's standing out in my mind, but I don't have that chart in front of me. I'd have to refer to it. But that chart is available at the, if you Googled like the American Urology Association age-related testosterone levels, I bet you could find that chart. Summer Breeze, thank you for coming. Yes, awesome. I love the name, by the way, and I can't wait to have a Summer Breeze. Okay. I know I'm a little behind in the questions, going through those. How come cholesterol is not a hormone if it affects all other hormones? Funny, Ardit. That's a great question. Cholesterol is the precursor. It is a steroid molecule that is the precursor to turn into the hormones. However, they're regulated by the pituitary gland. That's why it's not a hormone. But you're right. It does have to do with the hormones. Why, Smith? What do you recommend for recurring polyps every year? I have an IUD already. Okay. If you're having recurrent polyps, it's generally estrogen out of balance from progesterone. So I'd give it a deep look. I would look into maybe thinking about looking at your estrogen metabolism with one of the Vibrant tests or ZRT or Dutch's dried urine. Can you talk about the importance of bone health during menopause? Integrative RD, you know what? That is a great question. Did you guys know that the death rate 2 years after hip fracture is higher than 10 years after breast cancer? But yet everyone worries about breast cancer. But bone health is so important. Peak bone health is at age 30 and it decreases as you age. Estrogen therapy is indicated for prevention of bone loss. But we do a more deep dive into our bone health in our patients. We order some metabolites like CTX, PN1PN, which is looking at the breakdown and the building up, and a bone specific alk-phos to see, are you breaking down bone more than you're building it up? Yes, we do bone density, and we do all that on our patients and look at their hormone levels. So thank you for bringing that up. It's very important. Mish, what helps endometriosis? So off the top of my head, there's a couple of things. I do know that N-acetylcysteine has some good data that helps endometriosis. We would recommend 500 at least. And resveratrol, I believe it's also 500. Both of those have been studied in endometriosis and seem to have helped. Kristen, I was talking about pancreatic cancer and high doses of vitamin D, that there were a couple studies that show when your vitamin D is persistently high, it could be linked to an increased risk of pancreatic cancer. But, there's so many other things that can also affect that. A.M. Devaney, I'm severe endometriosis and adenomyosis. How do I know I need progesterone and not estrogen? So it really depends on if you're still cycling and what your levels are. Generally, if you're still having normal periods, you usually have enough estrogen and you just need progesterone. If you're skipping periods or not having periods, you could also need estrogen. But most of the time, people with endometriosis already have estrogen and need progesterone, or they need something to block aromatase. So zinc, chrysin, and medicines safe for a perimenopausal woman with a 0.05 patch. Yeah, that's actually sounds like a good dose. Let's see, my thumb is hurting, like some stingy pain or burning pain. What should I do? Okay, lots of reasons. Is it swollen? Is it hot to touch? There's a lot of things that you should probably get it checked out to see, because it's hard for me to really tell you without seeing it. Your thoughts on Elestrin gel? Is it better than estradiol gel? Great question. Elestrin is a form of estradiol gel. It is a bioemulsion, but it has a very long half-life, like 48 hours. So people who use that every day tend to accumulate. My preference is the Divigel. Both are estradiol, because Divigel has a 10-hour half-life and it doesn't seem to increase. So think about snow in Minnesota. Once it snows, if it doesn't melt, it's going to keep going, keep going, keep going. If it snows in North Carolina, they plow the roads. It doesn't snow that often, and there's no accumulation. But in the north, in North Dakota and Minnesota, it accumulates. That is an important content for estrogen gels and creams. So I don't mind Elestrin. I just don't dose it daily. Any thoughts on peptides? For kisapeptin, for PSSD, do you mean PTSD? I've been using intranasal oxytocin in my patients for low libido, especially people with PTSD or stress. Kisapeptin, I know that we've looked into that for libido also. But yes, I've been using in my patients the intranasal oxytocin with some good results. Can you talk about heart palpitations? Usually heart palpitations in perimenopause are from high estrogen and the lack of progesterone. So definitely something that we see a lot in our practice. I had to see 5 doctors to get anyone to listen to me. It's so sad and so hard. Well, I think that's why menopause is in the news. And it seems like there's a lot of people who are now focusing on that. Mish, can I skip periods for months during perimenopause? Yes, that happens. And once you skip one period and it goes 60 days, you're supposed to be in the late perimenopause. When would you recommend taking DIM? I would recommend taking DIM for a patient with high estrone and high estradiol after I see their estrogen metabolites to see that they don't go down one particular pathway, which is cytochrome 1A1, and they don't have enough going down that pathway. Katie Moore, how do you naturally balance your hormones? Wow, that is a very loaded question. I would refer you to our free course. I have tons of data on that. We have downloads that are free, but that is a very long question. And since my battery is almost dead, I really can't go into the details on that. But it touches on what you eat, how you move your body, your sleep, and your stress. Deb, MCBR, I'm 67, a new GYN suggests I go to low dose patch to help with bone and muscle loss. So it really depends on how long it's been since your last period and your cardiometabolic factors. We do a complete cardiovascular workup for anyone over 60, and it does matter when your last period was. It's only been 3 weeks, and my dry itchy skin has improved already. I'm hoping, Deb, you're also taking some progesterone with that. If you have endometriosis, do you automatically have PCOS? No, 2 different things. Can you repeat one time with recurring polyps? So recurring polyps makes me think of too much estrogen and not enough progesterone. Maggie, I got my period on day 19. I had it for 16 days. That could be perimenopause. It could also be low progesterone. I've been spotting every month since on HRT. I've had them for 8 months. So, Sol Maria, were you completely done with your periods before you started HRT? Had you been 1 year without a period? If so, you need to talk to your doctor about why you're spotting. Juvenile arthritis, blueprint, I'm 49 with regular periods. This month it came 1 week early. It can actually do that. That is not uncommon during perimenopause. Any harm or damage using Dr. FDA approved HGH? John, I don't think I'm the expert that would be able to answer that question for you, because that's not my area, but good luck. 58, you females, you always need blood work to start HRT, including DHEA. That's a really good question. Generally, I think it's a good idea. There are certain cases where people don't have ovaries, where we don't do blood work and we can start it, but generally, I think. The bone test that I like for osteoporosis is an bone-specific alkaline phosphatase, a CTX, and a PN1NP. Okay. Oh, Noah. Oh my gosh. Congratulations. I just heard you had a baby and I'm so excited for you. Josie was just home and she told me all about that. Okay, balancing mood. What about magnesium and fish oil? Those are two things that she's probably sleep deprived. So I'm hoping that you are giving her some rest and I hope everything goes okay. But magnesium is safe with breastfeeding and also some fish oil that can really help mood. All right, guys, my battery is just about dead. I'm sorry I didn't get to all the questions. Thank you to those of you who hopped on and check us out here from 7 to 7:30 on Tuesday nights. And for you that haven't seen our new free resources, check me out on Instagram. Check me out here in my bio. We've got a free download for your guide on testing, antidepressant or natural therapies for mood disorders, and a free hormone course. So check them all out. Sign up for our free newsletter and subscribe on YouTube, and we will catch you here. Will I be on next week? If I don't have a lecture, I'm pretty sure. I can't remember.
No.
See, not next week?
Nope.
Not next week. Oh yeah, I'll be driving back from our my son's graduation trip. So sounds good. All right, take care.